What are miotics used for in glaucoma treatment? Imagine a tiny muscle inside your eye that can help control a serious condition called glaucoma. Miotics are medications that target this muscle to help lower pressure. They work by increasing the drainage of fluid inside the eye, which is essential because high pressure can damage the optic nerve and lead to vision loss. The fluid, called aqueous humor, normally flows out through a drainage system called the trabecular meshwork. Miotics stimulate receptors on the iris and ciliary body, causing the pupil to constrict and the ciliary muscle to contract. When the pupil constricts, it opens up the drainage angle, making it easier for fluid to exit and reducing the pressure inside the eye. In cases of primary open-angle glaucoma, miotics help by improving the outflow of aqueous humor through the trabecular meshwork. For acute angle closure glaucoma, miotics like pilocarpine are especially useful because they cause the pupil to constrict rapidly. This pulls the iris away from the drainage angle, opening it up and relieving the pressure buildup that can cause sudden and painful vision problems. Pilocarpine is the most common miotic used in these situations because it acts directly on the receptors, mimicking the natural chemical acetylcholine. This dual action of pupil constriction and ciliary muscle contraction helps to lower intraocular pressure effectively. However, using miotics requires careful monitoring. Excessive pupil constriction can sometimes worsen the situation by pushing the lens forward or increasing iris contact with the lens, which might trigger angle closure in some patients. That's why eye doctors often perform regular examinations, like gonioscopy, to check the drainage angle and ensure the medication is working safely. Miotics are usually taken multiple times a day, such as 4 times daily when used alone or twice daily when combined with other treatments. Some common side effects include difficulty focusing, especially for near vision, because the pupil remains constricted. Others might experience a redness, headache, nausea, or increased salivation due to the parasympathetic effects of these drugs. In summary, miotics are valuable tools in managing glaucoma because they help drain fluid from the eye, lowering pressure, and protecting the optic nerve. They are particularly effective in acute angle closure glaucoma and can also be useful in primary open-angle glaucoma. But because they can cause side effects and sometimes worsen certain types of glaucoma, their use should always be guided by an eye care professional. If you or someone you know has glaucoma, it's important to follow medical advice and have regular eye exams to ensure the best possible outcome for eye health.